Do you have heavy periods? Do you want to stop suffering with them? Or maybe you don't even know what is a heavy period because you've just survived this for month after month after month, for year after year after year. Number one, know what's a heavy period. If you're bleeding through pads or tampons every 1 to 2 hours, if you're having clots larger than quarters, if you're incapacitated on a regular basis, those are a few clues that that's not normal and you need support for that and you need to look into that. Number two, why are you having them? Well, make sure you get a good diagnosis, because if it's something like cancer or a bleeding disorder, both of which can be the underlying root cause, then your treatment's going to be different, and make sure you work with a good provider you trust to get an accurate diagnosis. But to keep it simple and quick, a lot of times the reasons for heavy periods have to do with an imbalance of estrogen and progesterone. What does that mean? Estrogen is the dominant hormone in the first half of the cycle. As we grow the estrogen, we increase the estrogen, we're growing the uterine lining. If we ovulate, then that after ovulation, we can produce progesterone from a place called the corpus luteum. You don't need to know that, but the progesterone is important for making sure we don't have too much relative estrogen, such that our endometrial lining, the inside lining of the uterus, grows so thick that then you're bleeding like crazy because you don't have the progesterone to stop that growth and to regulate that cycle. So if you're not ovulating, that's a major reason for heavy periods. Why could that happen? There's a lot of reasons. So this is why it's important to work with a provider, but it could be polycystic ovarian syndrome. It could be super stress or underslept, right? If your body perceives that you're in danger, then fertility is kind of last on the agenda, right? So you might not be ovulating for that reason. It could be that you're training too hard, that your body perceives stress, or that you're underweight, or that you're not getting sufficient nutrients in order to support your hormone balance and these needs. Right? So it's an imbalance often of your estrogen with progesterone. So what could we do about it? Well, let's look at how we can support that balance and bringing it into balance. Why would we have too much estrogen? It could also be because we're getting too much exposure to estrogen through chemical exposure, endocrine disruptors. Are you using a lot of plastic? Are you eating plastics? Are you covering your skin and your skincare and using makeup and things all over your body that might be disrupting your chemicals? So look at toxins, look at alcohol, not your friend. And there's a couple of reasons for that that I'll go into in a minute, but where might you be getting estrogen? Are you eating a crap ton of dairy? Right? Are you eating really a large amount of animal products and not being able to eliminate and modulate that estrogen effectively? Well, you might look at why this would make a difference. But number one, take note of that, because every mammal has estrogen. And if you're intaking a lot of it, it can contribute to some of these imbalances. Okay, so those are some reasons why estrogen might be high. Now, what can you do about it? Well, estrogen is metabolized in 3 phases in your body. 2 phases in the liver, 1 phase in the gut, your 3rd phase in the gut. So what do we need to do? We need to make sure that your liver and your gut are supported. What's my top tips for doing that? There's a lot of ways we look at this. Get rid of the chemicals, use organic tampons or pads, or watch out what you're putting in your body. Ditch the alcohol. Come on, mocktails, sober curious is all the rage. Get on board if you're having heavy periods. Alcohol is not your friend. I'm sorry. I'm not a teetotaler, but I'm just telling you what is. Okay, so support your liver by avoiding excess toxins where you can, and support your gut, which the estrobolome, that subset of the microbiome, is pivotal for modulating those estrogens. So my favorite nutritional tips are ground flax, cruciferous vegetables, making sure you're hydrated, so detox your liver, with that whole detox organ that is your liver. You want to support that both by getting a lot of the saturated and processed foods out, saturated fats sources and processed foods out that are driving insulin resistance and can affect the liver health. We want to also support really good fiber sources. So bitter greens also are wonderful for detoxifying the liver, and especially cruciferous vegetables, which helps get that estrogen down the pathway it needs to go. Ground flax, soy, minimally processed soy is great for helping to modulate estrogen. So things like edamame, tofu, tempeh would be wonderful. I would encourage you to get those organic. I would mitigate or minimize your animal products, especially red meat, which tends to drive heavier periods. Yes, we kind of want to crave that because we think, oh, I'm anemic, I need red meat. But in fact, we see clear associations between worse, heavier periods with more red meat consumption. So red meat, processed meats, and dairy, really try to cut those down. Increase your fiber sources, your plant, whole plant, not processed plant sources by increasing the diversity of fiber, such as fermented foods, sauerkraut, and go from there. So that's a really great start to help detoxify the liver, to help support your gut, to clear out the things that are exacerbating the problem. And of course, do this with compassion, not criticism, right? Because stress and stress regulation and supporting joy in your journey and remembering that a true reward gets you closer to your finest self. So by removing these things, it's not about what you're giving up, it's about what you're gaining to help give your body the nutrients it needs to support your hormone balance. I really hope that you got something from this, and please let me know what else I can do to help educate you and empower you rather than just bombard you with ibuprofen and hormones, which is what almost every woman I've ever seen that goes into the doctor's office with heavy periods gets thrown at them, and never the power that they need to truly understand why are you struggling with this, because you don't need to. Thanks so much. Have a great day.